Many patients with heart failure grapple with related problems that threaten their feeling of well-being and even their quality of life. Now, patients look for ways to cope up with the new situation. Coping with such new circumstances for patients with chronic heart failure is definitely challenging because their physical, psychological, social, cultural, and religious aspects are affected. Mere emphasis on the physical aspect is not adequate for patients' health and welfare, and contribution of various other strategies, including religious coping ones, is required. We all are aware that religion is an important aspect of healthcare, and attention to religious needs has been increasingly emphasized by healthcare professionals. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and I'm going to talk about the impacts of spirituality on heart health. The American College of Cardiology and other major cardiovascular societies recommend palliative care for heart failure patients. Now, spirituality as a whole is a core domain of palliative care with the goal of identifying and addressing various spiritual concerns and providing patients with appropriate spiritual and religious resources. However, there has been very limited research that has been conducted till date on spirituality's impact on patients with heart failure, and there are no known tools designed to measure it. Numerous studies in the past have shown that spirituality can help improve the quality of life for people with chronic diseases like even cancer. Now, according to a literature review that was published in the JACC Heart Failure Journal, spirituality can also have a positive impact on the quality of life for heart failure patients. The research does mention that spirituality should be considered a potential target for palliative care interventions to improve patient-centered and clinical outcomes in these individuals. Though spirituality is very hard to define, several definitions have been occurred and they're still cropping up, but the one describes spirituality as how individuals find meaning and purpose in life which can be separated from religious beliefs. The researchers conducted a review in order to explore the current knowledge of spirituality in heart failure patients, and they described the associations between spirituality and the quality of life as well as the patient outcomes. There were approximately 10 varying instruments that were used to measure the spirituality. Some were simple, others were complex, and the authors concluded that not only can spirituality improve the quality of life for such patients, it can help support the caregivers and potentially help heart failure patients from needing to be readmitted to the hospital. This can be used to identify heart failure patients in palliative care who are at risk for spiritual distress. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.